So, what is sebaceous hyperplasia? Sebaceous hyperplasia happens when our oil glands, they're also called sebaceous glands, enlarge and create small bumps on the skin, especially on the forehead, cheeks, and nose. And they may feel like tiny cysts, but they're not as well defined, not as well formed. They often look like little soft, yellowish, or flesh colored domes with a tiny central dip, almost like a mini donut. It's very common as we get older, and some people have genetic predisposition to that as well. It's completely benign, meaning that it's not dangerous. But here's the catch. Sebaceous hyperplasia can look a lot like basal cell carcinoma, which is a type of skin cancer. Basal cell carcinoma, or BCC, often shows up as a pearly bump, and sometimes it even has visible blood vessels, or sometimes it has a small indent in the middle. Sounds familiar? And that is why sebaceous hyperplasia sometimes causes unnecessary panic, and why doctors, including myself, are always extra cautious. If there's any doubt, it's just better to do a simple biopsy to make sure that we're not missing something serious. So let's say we're sure that we're dealing with sebaceous hyperplasia. What is then the right way to treat it? At our clinic, my patients often ask me, can you just freeze it off with liquid nitrogen? And here's the thing, cryotherapy, freezing, is not the best treatment for sebaceous hyperplasia. It just doesn't get deep enough, and it can leave behind scarring or pigment changes without completely obliterating the actual spot. So instead, the best way to treat discrete sebaceous hyperplasia is cautery destruction. I numb the area with Novocaine, use a tiny, precise electrical pencil to gently dry out and destroy the enlarged oil gland right at its source. It's quick, it's done in the office, and healing is smooth with minimal risk of scarring when done properly. So in conclusion, if you notice any stubborn little bumps on your skin that just won't go away, don't panic. But don't ignore them either. It could be just a harmless sebaceous hyperplasia, or it could be something that needs a closer look. So always see your doctor to get the right diagnosis and the right treatment.